so Colonial Health almost killed me, actually.
It's a pretty rough experience, for sure.
George Washington University is home to over 10,000 undergraduate students, with the cost of attendance exceeding $60,000 per year. The expectation for student resources are high. One of these resources, the Colonial Health Center, provides medical services to students on campus in the Marvin Center. The Colonial Health Center is supposed to be a safe place for students to seek excellent medical advice, but many soon find that this is not the case. High costs, misdiagnoses, and long wait times plague students who just want affordable and accessible health care. Where are our tuition dollars going? And how do they not afford us the basic right, which is our health? We interviewed GW students about their personal experiences with the Colonial Health Center to find out just how bad the situation really is. Here's what they said.
The first time I went, because I had like a cough, I think it was strep throat or something, and the first thing they asked me was like, "Are you pregnant?" I was like, "No, I'm not pregnant." She's like, "Are you sure?" "No, I'm not pregnant. I was like, I might have strep throat or something. Can you like test for that?" She's like, "I don't think we should do that."
The worst part was I happen to have very sensitive ears. It's been a recurring thing medically for basically my entire life. And apparently the physician who was attending to me didn't see that on my chart. So she said, "Oh, you have a little bit of earwax in your ears. Let me get that for you." And took a Q-tip about this long and shoved it all the way down my ear canal and just sort of used a little bit of elbow grease to work it all out. I actually ended up not being able to hear out of that ear for the next 2 months. It was a serious problem. The only way it ended up getting fixed was because I sought the professional physicians over at Kaiser.
Had like a weird itchy throat thing, and then also had a weird rash, so I was like, oh my god, I'm having an allergic reaction. I'm like not a hypochondriac, but I was like, is this anaphylactic shock? Like at 4 p.m. on Friday, I was like finally done with class. I was like, okay, I'll go. And I went in and they were like, we're closed, we're closing in an hour, so we're not really taking anyone new. And I was like, I think I'm in anaphylactic shock. And so they were like, okay, like maybe we'll see you. So after about 20 minutes, they had a doctor come and look at me. I like opened my mouth for a second and they barely even looked at my throat, and they're like, no, you're not. And like they were like, but keep taking Benadryl. So they were like, it's not an allergic reaction, but keep taking Benadryl just in case. And literally the next day I got like this horrible cough, and then like 3 days later it got like worse and worse, and it was like in my lungs. So everyone was like, you have to go back to the health center, and I was like, all right, whatever. I just like had so much going on, I didn't want to go off campus. So I went back. They said it's bronchitis or sinus infection, and they gave me a couple of different medications. And another thing was they gave me very expensive like medications. So when I went to CVS to pick them up, the pharmacist was like, you know, like they have cheaper versions of this, and like called them and got them to change the prescriptions because they gave me one that was like $75 when there was like a $20 off-brand version.
Waited for about 15 to 20 minutes.
I was in there for probably 45 minutes.
I think I had to wait about an hour.
To wait like 2 hours.
Waited 2.5 hours.
I waited probably 2 hours, 2.5 hours. I missed my class. I just had to sit there until they saw me.
It was $30,
You
but
pay $30.
Charged me $40.
Was charged $55.
$50.
Charged me like $10 for that visit, even though I didn't like see anyone for any medical reason.
The woman told me that she had no idea what was wrong with me and charged me $60.
In general, I think that there's a lot of fees on campus that students have to pay for that you might not necessarily expect to have to pay for all these or realize how expensive they are when you're coming to college. So one thing I'd like to do is help reduce and restructure a lot of these fees, one of them being the cost of going to Colonial Health Center. It's currently $30 for an appointment. The cost keeps going up and the services aren't necessarily getting better. So I'd really like to see us find innovative ways to try to make as many things accessible to students as possible, especially the Colonial Health Center. Another thing I want to work on is kind of making it easier for students to be able to access off-campus providers. So, you know, potentially making some kind of guide or comprehensive list of ways that students can access off-campus providers and find things that work for their insurance or work for them and meet their needs. I've had a few bad experiences myself though, so I would say that generally the feedback is negative. I think it's a balance. I think that we need to find ways to make sure that what we're asking for is feasible and is possible and makes sense for our university. The administrators that I've met with so far have been really supportive in wanting to, and have really shown interest in wanting to improve the student experience as much as possible. So the passion is there, the sympathy is there, the empathy is there, and the willingness to try to find solutions is there. It's just a matter of, students need to make sure that we're doing our side of it, which is finding the problems and helping to figure out what those solutions are going to be. I think that's important.
I kind of have to. I don't want to because they have really, really crappy service, so.
Based on how much we spend, we should definitely have more accessibility to health resources. I don't think that they efficiently allocate their resources and they don't manage their time well. So that leaves a lot of students scrambling for other options, especially when there are serious health concerns involved.
With the GW, medical school and all that, we have all these resources where we're training, competent doctors and nurses and medical staff. I don't see why our clinic shouldn't be taking advantage of those resources.
I know we deserve better as GW students.